vitamins. As mentioned in the introduction, we have two groups of vitamins, the fat-soluble vitamins and the water-soluble vitamins. Both groups differ in some intrinsic characters that will be discussed later. For all vitamins, we are going to describe their role and mechanisms of their actions, and also describe the manifestations of their deficiencies. We start with the fat-soluble vitamins, which is a group of 4 vitamins: vitamin A, D, E, and K. Vitamin E is one of the antioxidants associated with cell membranes or present in cell membranes. It is a lipid-soluble antioxidant and functions in maintaining the fluidity of cell membranes. And regarding the structure, we have the vitamin E vitamins, which are alpha tocopherol and tocotrienol. The two families of vitamin E are with different biological potencies. There are the alpha or the E1, the beta or E2, gamma or E3, and the delta tocopherol. Deficiency of vitamin E is rare, but for the sources we have animal and plant sources. It's present in vegetable oils, which are rich sources. Also the green leafy vegetables. The meat, eggs, and liver also contain moderate amounts of vitamin E. The daily allowances of alpha tocopherol of vitamin E is about 15 milligrams for adults, and the requirements of the vitamin as other vitamins increase, but in this case or the case of vitamin E, it increases with increased intake of polyunsaturated fatty acids. The functions of vitamin E: it has an antioxidant function as it prevents the formation of peroxides in polyunsaturated fatty acids. And as mentioned earlier, vitamin E is a major lipid-soluble antioxidant in cell membranes and plasma lipoproteins. The main function of vitamin E is as a free radical scavenger. It's responsible for scavenging antioxidants, or is responsible for scavenging as we mentioned earlier, that vitamin E deficiency is rare, but deficiency may occur and manifest as hemolysis of RBCs and anemia, which is common in newborn infants. Dietary deficiency of vitamin E in human beings occurs in patients due to their inability to absorb or transport the vitamin, as in cases with severe fat malabsorption, cystic fibrosis, some forms of chronic liver disease, and maybe in obese patients receiving drugs that inhibit pancreatic lipase, that is responsible for digestion of lipids. So this vitamin is lost with undigested and unabsorbed fats. Hemolytic anemia, due to the abnormality or fragility of membranes as a result of lipid peroxidation occurs in premature infants due to their inadequate reserves of vitamin E. Also, there is some sort of muscle breakdown due to the nerve and muscle membrane damage, which occurs in severe cases of vitamin E deficiency. Vitamin K, or the last member of the fat-soluble vitamins. The structure of vitamin A, we have many forms of vitamin A, natural and synthetic. We have the vitamin K1 or phyloquinone, the vitamin K2 or menaquinone, which is synthesized by the intestinal bacterial flora in the intestine. The synthetic forms are menadione and menadione acetate, which are synthetic water-soluble forms used as drugs in case of vitamin K supplementation. The vitamin K sources are many. So vitamin K is found in cabbage, turnips, spinach, egg yolk, and liver, and also in broccoli. Also, there is the bacterial source from the gut. These bacteria synthesize vitamin K in the intestine, which is absorbed and used. The requirements for vitamin K is about 120 micrograms per day for adult males and a lesser amount for females. Vitamin K is involved in many functions. The first and most important of these functions is the synthesis of blood clotting factors in the liver. These factors are prothrombin, factors 7, 9, and factor 10. Vitamin K is responsible for activation of these factors. And this is by the following. The gamma carboxyglutamate residues in these clotting factors constitute the binding domains for calcium ions through which they can bind erythrocyte membrane phospholipids. The modification of the gamma carboxyglutamate is one of the post-translation modifications which occurs in the liver after synthesis of these proteins in the liver. When the anticoagulant factors bind calcium, they inhibit coagulation. The anticoagulant factors as citrate used as an anticoagulant in the laboratory with blood specimens, or dicumarole, which is an antagonist of vitamin K used to inhibit blood coagulation in patients at risk of thrombus formation. Warfarin is an example of these drugs that inhibits the active prothrombin synthesis by inhibiting vitamin K dependent carboxylation of glutamate to gamma carboxyglutamate. So vitamin K is an important cofactor for gamma carboxyglutamate formation, which is which is an important residue in the proteins or the blood clotting proteins. The requirements of vitamin K, as mentioned before, is about 120 micrograms per day for adult males and 90 micrograms for adult females. But a point has to be remembered. This point is regarding some foods that are not preferred for high-risk people or people with a history of thrombosis. These foods are taken like broccoli, cabbage. They are frequently used in salads, so these foods are better be avoided due to their richness in vitamin K. Continuing with the functions of vitamin K, vitamin K is important in the process of bone synthesis and other calcium binding proteins. As we mentioned, it has a role in the carboxylation of glutamate to gamma carboxyglutamate. And this includes the blood clotting factors and osteocalcin and the matrix gamma carboxyglutamate proteins in bones, nephrocalcin in the kidneys. So the gamma carboxyglutamate containing protein is a residue that bind calcium and is important in bones and in blood clotting factors. So through this osteocalcin, vitamin K stimulates bone formation and decreases bone resorption. And deficiency will be associated with weak bone formation due to reduced osteocalcin, which is a calcium binding protein in the bone matrix. Other vitamins with similar functions, as also vitamin K, is the vitamin C, which is required for bone formation. Also, vitamin A and vitamin D are of specific importance for bone metabolism, especially during bone formation. And this is mentioned in other lectures. The mechanism of vitamin K in activation of prothrombin. As we know that prothrombin is one of the blood clotting factors, and the prothrombin precursor contains 4 to 6 glutamic acid residues. And vitamin K is responsible or is a cofactor for the carboxylation reactions that occurs for these residues, converting them into gamma carboxyglutamate to convert the protein into an active thrombin. So, as you see, that vitamin K is a cofactor during the carboxylation reaction of glutamate. Gamma carboxyglutamate residues in clotting factors constitute the binding domains for calcium ions through which they can bind erythrocyte membranes and phospholipids, and these modifications, as mentioned, are post-translation modifications and occur in the liver after the protein is synthesized. The vitamin K antagonists, we have the dicumarol and warfarin, which are antagonists of vitamin K. Dicumarol is found in some plants fed to animals, and moldy sweet clover, and is responsible for the sweet clover disease in animals. Warfarin is a synthetic product and used as a rat poison. These anticoagulant factors bind calcium, so they inhibit coagulation, as what occurs with blood samples in the laboratory when we use citrate. But dicumarol, as an antagonist of vitamin K, is used to inhibit blood coagulation in patients who are at risk of thrombus formation. Warfarin, as an example of these drugs, inhibits the active prothrombin synthesis by inhibiting vitamin K dependent carboxylation of glutamate to form gamma carboxyglutamate, which is a calcium binding residue in these proteins. Thus, administration of vitamin K will bypass the coumarin induced inhibition and restores the process of blood coagulation. Vitamin K deficiency is manifested mostly as impairment of blood clotting, which occurs in some cases as newborn infants. These newborn infants have no bacteria in their intestine in their first days, so circumcision in newborns or any other operation is done either immediately after birth or is delayed 2 to 3 months later to guarantee the presence of the bacterially synthesized form of vitamin K. Also cases of persons which use antibiotics or the long use of antibiotics which kills bacterial flora in the intestine. This is also associated with biotin deficiency, which is one of the B vitamins. Also liver disease. As you know, the liver is a site of synthesis of prothrombin. Prolonged use of anticoagulants as dicumarol, an example of which is warfarin, which inhibits vitamin K assisted activation of clotting factors. And as mentioned earlier, that administration of vitamin K will bypass the coumarin induced inhibition. You can find more information about these topics in this site.